as Niyadamarana Khyapakam Lingam Arishtam. Arishta is something which is going to indicate that the person is going to die. And there is no possible ways of giving or bringing back him to a state of normalcy. Rather, our role will be limited to see that we give a painless end to him. So that's what is the meaning of the arishta. And arishta, as per Charaka, is defined as Kriyapatham atikrantam kevalam dehamapratam chinnam kurvanti maha yat doshaha tad arishtam niruchyate. So the lakshana which is evident in the entire sharira, which is an outcome of the spread of the dosha throughout the body, and where the doshas have bypassed all possible kriya patha or phases of progress of the diseases. So that is the arishta. And the important aspect here is the entire indriyasthana is coming with the arishta lakshanas. Where the arishta lakshanas are told, they are there in the indriyasthana. Why they are told in the indriyasthana? Because we want to create a good physician, because we have taught the clinical aspects in Nidanasthana. We want to our student to graduate from clinician to physician. So before they could give treatment, they should know their limitation. They should know in what all conditions they are not supposed to engage the treatment with the patient. They should not make any false claims, false promises. So with that caution, a sthana is entirely dedicated, and that sthana is known as the Indriya Sthana. And what is there in Indriya Sthana? Indriya Sthana gets connected to the definition of Ayurveda, because Manam cha tacha. We want to know the lifespan of a person, and the lifespan of a person can be known by Indriya Lakshanas. Because once the Indriya Lakshanas is seen, the Acharyas are very clear that the person may die immediately, may die in a 3 to 5 days, a 3 to 7 days span, or in 15 days, or in 1 month, 6 months, or the maximum duration is said to be 1 year. Once the Arishta Lakshana is seen, one can sustain the life not more than 1 year. So in a way, we are predicting the mana of a patient through the Arishta Lakshanas. That is the significance of Arishta and the Indriya Sthana. Now, the importance is also there, because clinically a patient has come, I misdiagnose him, I don't recognize the Arishta and give the treatment. So if the person dies at that point of time, then it creates a chaotic situation where Acharya Charaka says there will be Artha Vidya Yashohani Upakrosha Sangraham Prapnuyat Niyatam Vaidyo Yo Asadhyam Samupacharayat. So what does it mean? So it means when I treat a patient not knowing the Arishta Lakshanas, and if he dies, I will lose my money. Not that he will not give me the fees, but I may have to give the compensation. And Vidya, it is going to be a discredit to the science that I'm learning, because an Ayurveda doctor killed a patient. This is how the TV news will say, project me. Yashohani, my success will be brought to very reduced rather. Then Upakrosha, I have to sustain the anguish of the society. The people will be very angry with me. And Sangrahanasha, that is, I will lose my patient bulk also. So these are the outcome of mismanaging a patient without having a proper knowledge of Arishta Lakshanas. So in this background, the whole 12 chapters have been designed and said. And these have been told as Indriyasthana. And this Indriyasthana is having 12 chapters, around 378 sutras, and it exclusively deal with Arishta Lakshanas of different entities of Vikrita, Indriya, and the Sharira. And the reason for calling it as Indriyasthana are many, and they are like this. Okay. These are because we employ our Indriya to see the arishtas in the patient. A physician will do the examination using his own Indriya. That is the first reason. The second reason is he will see the Indriya of the patient. Indriya of the patient would become important because he will see with the eyes, the nose, the jibha, etc. And thereafter he will predict the lifespan. That is the second reason. The third reason is we have already defined that life is nothing other than indriyas. Sendriyam chetanam dravyam nirindriyam achetanam. With the chetana, indriyas are there, then only we'll call it as life. If the indriyas are not there, then there is no life. That's why indriya is chetana vachaka, suchaka shabda. And the prana is another entity which the Indian philosophers often believe that the prana leaves the sharira from one of the indriyas. So therefore, you would see some patients when they die, their mouth will be open, which means that the prana has left from the mouth. Some people would have twisted their nose. So it means that the prana has left from their nose. And in some, they may die with open eye, which essentially means that their prana has left from the eye. And if not all these, certainly it would have been left from their anal canal. So therefore, it is the indriyas through which the indriya adhishthanas through which the prana is living. So that allows the authors or that allows the Ayurveda rishis to say that this is going to be called as indriyasthana, very wisely and meticulously titled name for this sthana. Now, from the exam point of view, when we look into the chapters that are there, so we have as many as 12 chapters. The 12 chapters are coming as Varnasvarya Indriyadhyaya, Pushpitaka Indriyadhyaya, Parimarshaniya, Indriyanika Indriyadhyaya, Purvarupiya, Katamani Shaririya, Pannarupiya, Avakshirasiya, Yasya Sadhyomaraniya, and Anuchotiya, followed by the last one is Gomayachuraniya. And remember, all of these are talking about the signs and symptoms, the lakshanas, which are going to indicate the death. So this is an introduction to the Nidanasthana. As far as exam is concerned, what we can hope, what we can expect in Nidanasthana would be okay. From the exam point of view, the Nidanasthana total number of marks allotted is as little as 7 only. You will have questions which will be carrying, I'm talking about theory exams. We'll talk about practical at the end of this session. So there will be 7-mark questions that you can hope from Indriyasthana. There will be no long answer questions. And I am under the belief that all of you know these technical terms because you already faced the first professional exams. So you know there will be 4 long answer questions, 8 short answer questions, and 20 multiple choice questions, together a question paper of 100 marks, where a long answer question will carry 10 marks, a short answer question will carry 5 marks each. So as far as Indriyasthana is concerned, you have no questions coming of 10 marks. There will be only 1 question of 5 mark, and there will be only 2 multiple choice questions. So essentially, there will be a 7 marks is only the weightage that the Indriyasthana is carrying. Now, and going meticulously into the syllabus that has been provided to us by NCISM, from where that short answer question will come, from where that 5-mark question will come, you can see it can come from chapter number 1, 5, 7, 10, 11, and 12. So make sure you have no questions of 5 marks coming from chapter 2, 3, 4, 6, 8, and 9. So essentially, 6 of the 12 have been eliminated from this short answer question domain. So you have questions coming from Varnasvarya Indriyadhyaya. Just a minute. Sir, one seminar ಬರ್ತೇನೆ. Yes, I was talking about you can expect, I mean, and these NCISM syllabus is a guideline in such a way that every question paper setter, every university has to follow the same only. So they have mentioned that 1 short answer question shall be from these chapters: Varnasvarya Indriyadhyaya, Pannarupiya Indriyadhyaya, then you have Purvarupiya Indriyadhyaya, Sadhyomaraniya Indriyadhyaya, Anujotiya Indriyadhyaya, and Gomaichurniya Indriyadhyaya. You will get only one 5-mark question from this, and there will be no 5-mark questions coming from the second, third, fourth, sixth, eighth, and ninth chapter of this sthana. So make sure you focus, you give your weightage in as far as study is concerned in this way only. And there will be 2 MCQs, multiple choice questions only from Indriyasthana. And the first question shall come from either chapter 1, 2, 4, 5. And the second question shall be coming from chapter 8, 9, 11, and 12. So essentially, there will be no multiple choice questions that are coming from chapter 3, 6, 7, and 10. So you have to, and there will be 2 questions, and one in the first group, and the second will be on the second group. So you is required to know, keep these in mind so that you prioritize your reading. Your reading for examination is certainly slightly different from your reading for your practice and for your life. But exams are also a very essential part. And therefore, you have to remember that there shall be no multiple choice questions from 3, 6, 7, and 10, which is as per your syllabus. Now, how do we approach the questions? When the question paper is in your hand, how do we approach the question? This slide is talking about a general approach, whether it is for 5-mark question or for 10-mark question, or even for MCQ also. You have to read the question properly, basically. Now, once the question is in your hand, and this is not necessary that it should be only to Samhita-Siddhanta, this can be applicable to other subjects also. Now, once the question is there, identify the verb in the question. Now, what is the verb? The verb is there, and it is called as an action verb that you have to do it. When it is asked to define, then you should ensure that you are defining. Now, many times I have seen many papers where they'll write everything except the definition. Now, everything will become meaningful only when you write what is essential, right? So, everything can add value to your questions only when you write what is required, right? So, therefore, read, identify the verb, and answer it properly. If it is asked you to define, you define. When you are asked to explain, you have to explain only. And when you are asked to enumerate, you have to make a list of the things. For example, enumerate Dasha Pranayatana. You have to go on making a list. Enumerate Ashta Vyadhis. You have to make a list of Ashta Vyadhis. When you are asked to differentiate, then you have to differentiate. And particularly when we talk about differentiating, it is expected that you should make 2 tables and give proper differentiation, point-wise differentiation. And distinguishing, classifying should run as tables or charts is concerned. So when a question is in your hand, make sure you have read it properly and understood. And the understanding is, this aspect is particularly related to language, and English language I'm talking about. So identify the verb and be focused on what is asked, and prioritize on writing what is asked. Now, what is not asked but relevant, allied matter is there, you can write it after writing what is essential only. So identify the verb and proceed. Now, what should be our approach towards the 5-mark questions? Our general approach towards the 5-mark question will be, answers are expected in around 3 to 4 paragraphs, and you are expected to give explanations, because this is a short answer question, and short answers are certainly the answers where you need some sort of explanation. And the NCISM syllabus has given you list of shlokas to be by hearted, and accordingly you have to place the shlokas in your answer, right? You have the list of shlokas for each chapter has been mentioned, that these shlokas have to be by hearted, and all those by hearted shlokas shall come in your answer booklet. So try to put a minimum of one shloka per answer. And whenever you are asked to enumerate on an list, make sure that you write them vertically, one below the other, and not horizontally. Because when you write the horizontally, the tendency of skipping one is more. The tendency of you missing one is also more. So you may miss, or the examiner who is evaluating your answer booklet may miss. So therefore, write one below the other, so that you're sending a clear message that you know all the numbers, and the evaluator he finds it easy to evaluate. So one of the aspect of writing a good question paper is making a good answer paper is making it as easy as possible for evaluators. Now, I have to say, what is the mindset of a evaluator? Those papers on whom an evaluator spends generally less time would carry more marks. What it means? It means if you are writing legibly, cleanly, neatly, the reading becomes more easier for the evaluators, and evaluators would be inclined to give you more marks when you write in a way that is pleasing to the evaluator. How can we please the evaluator? I will come to that very soon. Now, how should we approach for read it as 10-mark question? This slide was prepared slightly a bit in the past. So please read it as a long answer question. So read the question once again. Identify if there are questions has got multiple segments. If multiple segments are there, then you require to plan accordingly. Then you plan the answer, right? Before starting writing, you can use the last page of the booklet to plan, right? I will write this as introduction. This will come in the main content. This will be my conclusion. This will be the chart that I'll put. Like that, you will plan what I will write in the book, in the answer for this 10-mark question. What are the shlokas that I'll be bringing in this answer? Then set introduction. Give a brief introduction and then build the answer. And divide the answer into different components, right? For example, you may bring about introduction. You may give a title as classification of the types. Then you may bring about the applications, uses, utilities, clinical importance. All these can be your different components or different headings under which you will write the long answer questions. Add examples whenever provided. Then I'm providing a brief checklist, which also you should have it, where you will see after writing whether this is met or not. This is because if I ask as a student which one you'll like, most of you will say that it is the colored rice rather the plain rice. Now, this is what is the mindset of evaluator also. He doesn't like the bland, tasteless, monotonous answers, right? And obviously this rice, the colored rice, has got more ingredients and more tastier and more healthier. It is acceptable. And more ingredients, more values can be added in terms of your answer when you focus on these aspects. How to make answers more attractive. The answers become more attractive when you add shlokas. You saw in the previous slide, it was a vegetable pulao, and you could see some cashews. The shlokas are like cashews in your answers, right? Add as many shlokas as possible, but make sure they are relevant to the question that is being asked. The second one is Sanskrit words. Now, I have seen many students where they will write the Sanskrit words into English. Writing dosha, D-O-S-H-A doesn't make much difference. But think of writing Prakriti Samasamaveta. Prakriti Samasamaveta, if you write it in Sanskrit, it becomes easy for reading. And Prakriti Samasamaveta, if you write it in English, it becomes not that easy. And even if you, the tendency of you making spelling mistakes are also more there, and the evaluator will not receive it in a good sense. So it would be very welcome if you can bring about the technical words, more important words, to be written in Devanagari script. That is, Sanskrit words be written in Sanskrit language only. Then whenever required, you can bring about charts, flow charts, particularly when you talk about Samprapti, etc. Charts and flow charts are expected. When you bring about, there is a possibility of bringing tables, or rather you can bring about table for Aharaja Nidana, Viharaja Nidana, etc. when the questions are related to Nidanas. Then if possible, bring pictures and drawings. You can draw some small drawing which depict the Samprapti of a disease. Then you bring, certainly this is, the next one is very essential, bring titles and subtitles. Now, subtitles and titles are very essential for a long answer question, because everything has to be arranged in a proper sequence, and the sequence has to be divided by proper titles and subtitles. Writing titles and subtitles would certainly give you more weightage when it comes to scoring more. And you have written something which are very important, very you want that this has to be read by the evaluator. Then make sure that you are making an underline for all those things. So underlining, highlighting is not possible in theory exams, because you don't have the option of using any other color. So as much as possible, you can underline some things which you want that the evaluators completely must definitely read it. So that these are some of the tips that you can employ in scoring more for that 10-mark question, that is the long answer questions. So these are the common mistakes that are done, which, since you have already gone through the first profession, you know how will be the question paper, you know how will be the answer paper, and I hope that these are not repeated. Now, approach for MCQs. Now, just remember there are 20 MCQs and there are no negative markings. So, answer all the questions. Whether you know it or you don't know, that is a part. You have to definitely answer if you know. If you don't know, then you have to calculate. You have to take some calculated risk. You have to do some guesswork. You have to imagine the answer. Then you have to write it. Right? Answer all the questions compulsorily. Then read the question carefully. There, and particularly when the word not is coming, which of the following is not? And when such questions are there, then you have to read it twice. And this is the third one, is an important one. As much as possible, try to answer the question without looking at the options. Now, the question is there. You read the question and you answer. The answer should come to your mind before looking into the options. Options should only confirm your knowledge. So in that case, it becomes you will not make any mistake for that question. And whenever you are in doubt, try to eliminate the questions. Eliminate the options. There is a question. You have 4 options. 1 is correct. The 3 are not correct. And it is a deductive method where you go on, this is not correct. Remove it. This is not correct. And this also may not be correct. Hence, this may be the correct. This is the elimination method of answering the multiple choice questions. And just remember, there will be many questions which will have A, B, C as options, and D would be all the above. And not all the above will be the real answers. So be cautious and look only for the qualifying answers. If A is answer, accepted. If B is answer, accepted. C, I don't know, but D is coming as all above. That at that point of time, you can go for all the above. And then you will find extreme numeric values. For example, these can be in terms of values. For example, I'll connect it to the first year subject itself. The pramana of rakta, ashtanjali, ashtadashanjali. If these are the options, then obviously the extreme value, which is not going to be coming as Ashtadasha, etc., gets eliminated. So these are some of the tips that you can employ as far as MCQ is concerned. So this I already have discussed. Now coming to, oh, okay, this we have already discussed. Now coming to the probable questions that can come from the Indriyasthana. We know that we have only 4 chapters to be focused on, and they are like this. As you know, it all starts with the first chapter. First chapter is known as Varnaswariya Indriyadhyaya, which starts with certain Pariksha Bhava. So here you have list of 44 Pariksha Bhavas, which are going to help you ascertain the remaining lifespan of a person. Right. Ayushaha Pramana Avashesha Jnana. So how to know the remaining lifespan of a person can be a 5-mark question. The answer is available in the first chapter, 3rd shloka. And then you will talk about the classification of arishta. The classification of these bhava themselves will become the arishta, and which are coming as Purusha Samshrita Bhava and Purusha Anashrita Bhava. Purusha Samshrita Bhava, the bhava which you will examine and see the patient, and those which are absolute, those factors which are independent of the patient will be called as Purusha Anashrita Bhava. There can be this classification of Pariksha Bhava. The question can also come as differentiate between Purusha Samshrita and Purusha Anashrita Arishta. So that can be a 5-mark question. The next 5-mark question can be the Prakriti. Now you would have learned Prakriti in Sharira Kriya of first year BMS, and there also you have learnt these terms only. Jati Prasakta, Kula Prasakta, Deshanupatini, Kalanupatini, Vayonupatini, Pratyatmaniyata are the various factors that will decide the Prakriti, and that Prakriti can be a question, a 5-mark question in Indriyasthana. And differentiate between Prakriti and Vikriti can also be a question. And the entire Vikriti can be a question, because Vikriti here is of 3 kinds. One is Lakshana Nimitta, the other one is Laksha Nimitta, and the third one is Nimittanurupa, where essentially the Nimittanurupa would be taken forward as Arishta Lakshanas. So I have discussed here 4 likely questions. One is Atura Avashesha Pramana Jnana. The second one is the classification of Arishta or Pariksha Bhava. The third one is the Prakriti. The fourth one is the Vikriti. Vikritis are 3, Lakshana Nimitta, Laksha Nimitta, and Nimittanurupa. And Arishta definition is also a possibility, but this is coming in the later chapter. Fine. So then that all turned out to be an introductory segment of Varnaswariya Indriyadhyaya. Actual chapter starts with the Prakrita and Vikrita Varna. Okay. So the question can be enumerate or discuss Varna as Arishta Lakshana. Now here you have to bring this chapter shloka number 9. Which are Varna Vishayaka Arishta? What are the Arishta Lakshanas related to Varna? So we should you should be aware that there are 4 Prakrita Varna, and remaining would be Vikrita Varna, and you will see where all the Vikriti and how the Varna differentiation would be interpreted as Arishtas. So this you have to write as when a Varna Vishayaka Arishta has been asked. And Swara Vishayaka Arishta is the next question. Swara is, we know what are the Prakrita Swara also. Here you'll see Prakrita Swara, Vikrita Swara bifurcation has to happen. And there can be a question related to Swara Vikriti. So I gave you approximately around 7 questions that can come in the first chapter. And we know second chapter, we don't have questions. Third chapter also, we don't have questions. The fourth chapter is Indriyanika Indriyadhyaya, which also doesn't have any questions. The fifth one is coming as, okay, here. Fifth one is Purvarupiya Indriyadhyaya. What the chapter deals with is the arishta lakshanas observed in the Purva Rupa Avastha of these jwaras, these diseases. The diseases are jwara, yakshma, raktapitta, gulma, kushtha, unmada, apasmara. The important aspect of all these is, in all these lakshanas, the patient will be dreaming. Along with the lakshana, the dreams are there. The swapna vishayaka arishtas are there. In all those diseases, you have to remember. So hereafter, the entire chapter is dedicated to Swapna Vishayaka Arishta. Certainly, there is a possibility of asking, or explain, or write, give examples for Swapna related Arishtas. So before, well in advance, remember 4 to 5 Arishta Lakshanas related to Swapna and write them meticulously properly. These are like the most likely questions you can prepare by heart also. If you don't understand, then go ahead. Because once this is asked, Swapna Vishayaka Arishta, you don't have to do too many things. Just remember and write it. So these are the two possible likely questions that can come in chapter number 5. 6 is also not there. 7th is there. 7th becomes Pannarupiya. Pannarupa means Nashtarupa. Rupa, here we talk about the things like Chaya, Pratichaya, Prabha. But perhaps the most frequently asked question is differentiate between Chaya and Prabha. Right. You will have a 5-mark question to asking you differentiate between Chaya and Prabha. You have to define what is Chaya, what is Prabha, and how they are differing. That is how you have to write. So one is complexion, the other one is luster. One has 5 types, the other has got 7 types. One is based on 5 Mahabhuta, whereas the other is based on only 1 Mahabhuta, Teja. One can be seen from far the distance. One can be seen only from the near when you go nearer to the patient. So these are the differences that you have to mention when it comes to the question related to Pannarupiya Indriyadhyaya. 8th, 9th, not important. 10th is one thing which is known as Sadhyomaraniya Indriyadhyaya. The definition is certainly an important. Sadhya doesn't here means immediate or instant. As per Chakrapani, it is 3 to 7 days period. Death within 3 to 7 days is known as Sadhyo Marana. And here, what is occurring is you have Arishta related to Hridaya and Vayu. Very small chapter, but the Lakshanas which are the affecting the Hridaya Marma can cause the sudden death. This has to be remembered. Anujyotiya, again, as the title itself is telling, the Agni is becoming very low. And when the Agni becomes Agni, the lowering of Agni is certainly an entity when as one grows old. And in the context of Agni, you might have heard a statement, Shantegno Mriyate. So when the Agni Shanti occurs, the person dies. But the person would have already started the process of lowering the Agni. And these days, the modern physiologists have a different term for that. They call it as slowdown of the metabolism. So that is being discussed in Anuchotiya Indriyadhyaya. The 12th one, the last one is Gomaya Churniya Indriyadhyaya, where the most likely question can be on the context of Dutadikara, messenger. So question can be on what is Prashasta Duta. Prashasta Duta Lakshana have to be written with reference to his appearance, the mode of travel, the time of entrance of the messenger to the patient, to the doctor's home. So those can be the Prashasta Duta, and you can have a question on a Prashasta Duta also. So these are some of the likely questions related to the Indriyasthana. I had put some questions also. In which chapter the definition of arishta is mentioned? It can be an MCQ. You would find it in 11th chapter, that is Anuchoti Indriyadhyaya. Then Ashtamahagada are available in which chapter? Can be an MCQ. The answer is it is 9th chapter, which is Yaseshavanimittiyadhyaya, and these have been listed as Ashtagadas. So this is with reference to the inputs related to the Indriyasthana. Now we shall go to the next sthana, that is Nidanasthana, and the Okay. Nidanasthana. Nidanasthana will attract questions of 19 marks. Now, how the marks gets divided. Now, there will be a one question and there are 8 adhyayas. Of the 8 adhyayas, except the third adhyaya, that is Gulma Nidana, there can be a long answer question that can come from any chapter. It may come from Jwara, Rakta Pitta, Prameha, Kushtha, Shosha, Unmada, Pasmara. You can have one long answer questions from Nidanasthana, and that will not be coming from Gulma Nidana Adhyaya. There will be one short answer question, and that short answer question can be from any of the 8 chapters, right? It can come from any of the 8 chapters. One 5 mark question will be coming, and there will be 4 multiple choice questions. And 4 multiple choice questions are divided in such a way that one question from 2 chapters, 2 concurrent chapters, that is one question, one MCQ from chapter between chapter 1 and 2, between Chwara Nidana, Rakta Pitta Nidana, you will have one MCQ. Between Gulma and Meha, you will have one. Kushtha and Shosha, you'll have one. And between Unmada and Apasmara, you will have one MCQs. That's how the MCQs are divided. That's how they will be coming. Now, the indriyasthana, Nidanasthana is placed immediately because we want to have an early diagnosis. We want to understand the diseases and the pathogenesis and prevent the complications. That is the purpose why it is placed immediately after the Sutrasthana and before the Vimana and Indriya, which also essential before we go in for any treatment. And the concepts that are dealt are, you will learn in the beginning the Nidana Panchaka, which are there in the first chapter. And there are quite a few concepts. For example, you learn Nidana Arthakara Roga in the last chapter. You learn about the origin of the diseases in the first as well as the 8th chapter. You will find out the mythological history of all the diseases. You have only 8 diseases to be learned here. Why only 8 is also answered through that mythological story itself. And all 8 diseases are related to respective srotasas. And symbolically from each srotas, you have one diseases. That is another possible reason why we have only 8 adhyayas to be learned in Nidanasthana. So these are some of the issues that you'll find in Nidanasthana. So you have, as I said, Jwara Nidana, Rakta Pitta Nidana, Gulma Nidana, Prameha, Kushtha, Shosha, Unmada, Pasmara are the Nidanasthana chapters. Now, as far as the chapter-wise possible, likely long answer questions, short answer question, I have listed some of them. So we'll just run through them, and later to that, if there are any questions, we'll take the questions. So the first chapter, which is Jwara Nidana Adhyaya, which begins actually with the Nidana Panchaka. You may have a long answer question on Nidana Panchaka itself, right? Explain Nidana Panchaka with suitable examples. Explain the importance of Nidana Panchaka. This can be another way of asking the same question. Explain Nidana Panchaka and elaborate on Nidana Purva Rupa Lakshana, etc. Or there can be a long answer question that can come on the Jwara itself. It can be Samprapti Lakshana of Jwara. It can be write the Lakshana of all 8 types of Jwara. So such possibilities are there. As far as short answer questions are there, describe Upashaya. Remember, all long answer question can be broken and asked as short answer questions. This you should remember. So therefore, there is no scope of repeating them in my slides. So all those which are coming as long answer question may be fragmented, may be broken and asked as 5-mark questions. So describe the Upashaya. You have 18 types of Upashaya that can be a 5-mark questions. Interpret the classification Samprapti. You have different types of Sampraptis, which may be a 5-mark question. Describe Agantu Jwara only. That can be a 5-mark question. That can be a short answer questions. The second chapter is the Rakta Pitta. The long answer question can be as simple as explain Nidana Samprapti Lakshana of Rakta Pitta. You can, the question may also include explain Nidana Samprapti, Bheda and Lakshana of Rakta Pitta. That can be a long answer question. Short answer question can be outline Rakta Pitta, Nidana and Samprapti. You just have to write the Nidana Samprapti. Only Nidana can also be asked. You may be a question, there may be a question like define Rakta Pitta and outline the Purva Rupa and Upadrava of Rakta Pitta. Illustrate the Sadhya Sadhyatva of Rakta Pitta can be a question. Remember, all these are the possible 5-mark questions from the Rakta Pitta Nidana Adhyaya. Gulma, we know that there will be no long answer questions. So the short answer question can be write the features of any of them, any of the type of Gulma, or all, or most repeated question in the history of Charaka Samhita question paper is the Rakta Gulma. Describe the Rakta Gulma Samprapti, Lakshana, and that can be a 5-mark question that is related to the Rakta Pitta Nidana Adhyaya, which is the third one. The fourth one you can be interpret the Nidana Samprapti Bheda of the Prameha. It can be with reference to Vatajameha. It can be with reference to Pittajameha. It can be with reference to Kafajameha. So it can be, I mean, that one sentence may connect it to all 3 possible questions. So all can be a long answer questions. Explain in detail the Kafajameha itself. You may have to write all the 10 Kafajameha as a part of your long answer questions. So the short answer questions can be the Vikara Vikhatakara Bhava, one of the repeatedly asked question. The Nidana and Samprapti Ghataka of Prameha. The Nidanas may be asked quite often. Then this is another which talk about the Samprapti itself. Relate the Nidana, Dosha, Dosha, Samprapti, Vataja, Pittaja, Kafaja, Prameha. It can be Nidana, Dosha, Dosha, Samprapti of Vataja, Prameha for 5 marks. The same of Pittaja Prameha for 5 marks, Kafaja Prameha for 5 marks. And you may be asked questions on Sadhya Sadhyatva of Prameha. These can be a 5-mark questions on the Prameha Nidana Adhyaya. The long answer questions on Kushta Nidana is right Hetu Samprapti Bheda of Kushta can be a question. Explain Kushta Veda and their Lakshanas, where you talk about all the Bheda of Kushta and write the respective Lakshana of each of them. So short answer questions can be outline the Samanya Nidana of Kushta. So you have a host of Nidana. The Samanya Nidana of Kushta can be a 5-mark question. Purva Rupa of Kushta can be, and the Upadrava can be asked as a 5-mark question. Then on Shosha, you have 4 types of Shosha. Write the Hetu Samprapti Lakshana of any of them or all of them. Sandharana Janya Shosha can be a long answer question. So then Lakshana of Shosha can be asked, and you have Ekadasha Rupa Shosha can come as 5-mark question. Shosha Nidana can come as 5-mark question. Shosha Purva Rupa can come as a 5-mark question. Essentially, we're talking about Rajayakshmi. The 6th chapter is the Unmada, and the 7th one is Apasmara. Now, you can have a question. 10-mark question can be Hetu Lakshana Samprapti of Unmada or Hetu Lakshana Samprapti of Apasmara, and which may also include the Bheda. Explain 5 types of Unmada, Hetu Lakshana Samprapti, or explain 4 types of Apasmara, the same Hetu Lakshana and Samprapti. So these can be a long answer questions. The short answer question can be the Bhutonmada, can be any of the Unmada, can be any of the Apasmara. And following this, we have concepts. For example, we have Hetu Sankara, we have Vyadhi Sankara, we have Linga Sankara. The concept of Sankara itself may be a 5-mark question. Then you have Nidanarthakara Roga as a concept, which is also coming as a 5-mark question. So these are some of the inputs that I can give as far as theory exams of the 2 sthana, the Nidanasthana and Indriyasthana are concerned. So essentially, it is 7 marks for Indriyasthana, and 19 marks are there for Nidanasthana, and where all the questions can come. And all these are the questions. And as far as Nidanasthana is concerned, I have to tell that you are learning all these diseases in detail again at a full length and breadth in your Roganidana Vikriti Vidyana. So therefore, there is no harm in bringing that information also as a supportive material in answering Charaka Samhita, but make sure that all the information which is related to modern medical science may not be relevant in answering Charaka Samhita's question. So you may additional information once you write what is there in Charaka Samhita, the additional information what Sushruta says, what Madhavakara says may be supplemented. So that amount of freedom is given to you. So this is what I have got to say as far as your theory exams is concerned. And following which you have practicals also. And the distribution of marks as far as practical exam is concerned, this is a screenshot of what is there in the NCISM syllabus copy itself. So Viva will be there on practical record, and which carries 10 marks. There are list of shlokas that you have to by heart, and the examiner will be asking certain shlokas, and that carries 10 marks. And there will be Viva on Vyakhyana. A shloka will be given, and you have to explain the meaning of that shloka, and that carries 5 marks. Viva on Sutrasthana is for 20 marks. Viva on Nidanasthana is for 10 marks. Viva on Vimanasthana will be on 10 marks. Viva on Sharirasthana will carry 5 marks. Viva on Indriyasthana will carry 5 marks. So for the two sthana that I have, Nidanasthana has got Viva component of 10 marks, and Indriyasthana has got Viva component of 5 marks. This is how the division of marks is there as far as the Indriya and Nidanasthana is concerned. So with these messages, I conclude my presentation and wishing each one of you come with flying colors. May each one of you who are attending exceed in your exams and be the best out of you shall come in your answer booklet as well as in your Viva. Wish you all the best of luck, and again congratulate and thank the organizers for this opportunity. If there are any questions, we'll take the questions.
Thank you, sir. It's my privilege to extend a heartfelt vote of thanks to our esteemed speaker, Dr. Anand Katti, sir, for delivering such an informative session. And I'm very thankful for the central team of Jignasa for the constant support, and I would extend a heartfelt gratitude to the whole team of Jignasa. Thank you, sir. Thank you so much.